Hello and welcome to this exciting episode. AI impact on healthcare workers, Stargate, and much more. So, without delay, let us welcome the Gordons. Welcome to
Hello,
the show.
hello.
Hello, good morning.
Good morning. Good morning. So, what's the discussion today? It's healthcare. I mean, the Stargate has been launched. We know that Oracle, Sam Altman, Trump made big announcements. So, how does it impact on healthcare workers? So, let's discuss.
My first question to you would be how does the integration of AI affect the job roles and training within the healthcare clinics?
Actually, the AI is going to significantly impact the jobs in the healthcare clinics because I think many of the functions, and I have a lot of experience in that, building EMR plus CRM combination, and I can see as a developer, I can see that I can replace many functions like EMR record keeping, EMR integration with payers, insurance companies, EMR integration with people who have to be like the sub vendors. So all those three functions can be easily replaced. And so I think we with AI bots, and I'm sure many people are developing those AI bots, and they will be working on these aspects. So I think we from Learn Think Share, we have to focus on. I think we are going to provide the mindset change needed to adapt to these new changes. So I'm looking at around 15 to 20% reduction in next 2 years.
Yeah, very, very essential. Like you say, it's already impacting the job market. So what we're looking at is helping people deal with the change. It's here. So it's not like 5 years ago people speculated, right? We knew it was coming. But as you know, old people in an industry say, oh, no, it's not really going to affect us. Now they need to take it serious, and we can help. We can help with the mindset transition into the new opportunities, the changing market, and what jobs are going to be available, because there are going to be new jobs available, the new creation of jobs that aren't there now.
The use case scenario will be a new patient walks in and somebody scans their previous card and the ICD-11 codes automatically pop up. Billing is already done, and because the biggest problem for small clinics is the billing is the main problem,
Right.
and their requests getting denied, the documentation needed. So all those things will be immediately uh, can be easily solved with AI. These are workflow related issues, and the bots can do all those mimic all those human functions for every clinic.
Yeah, and you're talking about the records and insurance, and that brings up the question that people always jump to in the hospital world with HIPAA. What about privacy? What about confidentiality? Who has access to the records, and is it going to make it, a breach? Is it going to be more accessible to people, or is it going to be more secure?
No, there is a mindset change needed. Only in the USA, HIPAA adds 35 to 40% of the cost of medical health care. Just HIPAA. HIPAA itself has to change because I don't care if my records are shared with 1,000 people as long as I get cheaper healthcare. I don't care. Put down my cost by 30%, share my record with the whole world. Put it on Google. I don't care. Just remove my name. And so who cares? And so HIPAA is an archaic law, and I know that this was created, and this is making the American healthcare industry make a lot of money, IT industry. And so I've been writing about HIPAA critically for so many years. If I give a choice to a patient, I reduce your medical bill by 40%, or you want to go through HIPAA. Everybody will say, reduce it by 40%. I don't care. I just want to receive in healthcare. I give an example. A tooth removal in other countries is 400% cheaper than in USA. 400% cheaper. So it's like if you are saying that 400% is too much. I'll say if I'm paying $4,000 here, insurance company, and so in another country I'm going to pay $40. So how many percentage is that? And add the additional ones like a root canal. Root canal, how much we charge, we know, and what they charge us is just a copay. But what they bill to the insurance company is totally different. So all those things are, and I really like that we are a growing economy now, no longer the first world and the developed economy. So that means changes are going to happen in a much bigger way. That we have to get used to what we used to call the third world business practices are going to come in here. And AI is going to make it exactly like that.
Okay. Um, this brings me to another point for you is that with AI coming into the healthcare clinics, for example, the AI can give you results for an X-ray or an MRI scan. How do you make sure that healthcare clinic workers, human workers, don't lose their critical thinking skills as far as making a diagnosis and relying 100% on the AI bot?
Great question, because remember what happened with calculators. What happened with calculators, and this is like the big daddy of calculators. So calculators still needed us to punch some numbers. Even that is not needed now. So now it's going to severely impede the critical reasoning ability of many people, not critical thinking. People still think, but reasoning is going to affect. And I think we need to have a new mindset, and probably they have to introduce chess in the clinic so that humans can be still thinking more actively, or some other game which can keep up with the mental side. It is going to affect big time, because I think the already the bar for entrance into these jobs is very less. People need to know the process, and they don't need to think. And somehow we have made a society where we want people to actually follow step 1 and step 2, and cannot go to step 4. They have to go to step 3 first. So there are a lot of process delays. I think this is going to eliminate process delays, but on the human side, it's going to eliminate a time. So that I think the free time is going to kill many people, because now the free time which is available to them, now they have to think how they can use it. And I think that's where we come in as learn, think, and share, where we can impart those necessary skills needed to fine tune the mindset, or change or make the critical thinking ability a little bit higher through our programs, because that will be very much needed now in the society.
And when I think our programs come in and share is that people often overlook. Okay, you get a nurse. You have nurses that are fresh out of nursing school. You have nurses that have been there 30 years. So they went to school 40 years ago. So such a diverse mindset and skill set. Now all of a sudden everybody has to get on the same modern page. And I see that happens a lot in companies, that they think one brush stroke is going to suit it all. Where the individual has to own where they're computer skills. Or are you a young person who came out who knows technology? And so you can't treat them the same. It's a different mindset, a different approach.
Like I was really shocked at the Oracle's CEO, Larry, talking about the how the cancers will be cured and how data. You know, technologists should not overstep their boundaries. I feel that way, because how at the end of the day you are just providing information, but the malignant tumors in the body and all those things, they are still to be resolved by proper medicinal procedures or preventive cure. And I so the just because the technology is there, it will still ease the process, not solve the problem. So I'm looking at the process reduction by 34%, but the actual effect on the cancer, I do not know that, because I think that is we have to adopt a different kind of lifestyle, I think, and different type of mindset, that we all gear towards a preventative method rather than actual curing method.
Yeah, great point. And that leads me to the next point is we talked about the healthcare workers, but the key ingredient of the healthcare market is patients. So how are the patients going to react to the AI? How are the patients going to react to maybe just talking to a robot or talking to some sort of technology instead of having the interaction with a triage nurse and the 5, 7 people you meet when you go to a hospital visit.
You see, one thing, Richard, is that even with the telemedicine, the costs have not come down. Costs have not come down. Costs are still there. So the profitability has increased for the hospitals, and the payment payout has been increased. I see a problem for the insurance companies, not for the
Yes.
patient. Insurance companies, that how fast they're going to process it, because the insurance companies love to delay payments and cut the payments down. With AI, not possible. So do they have enough money to pay for every single care? What they do is that they take for Tom and give it to Harry. So I think the more insurance regulations will be a problem. Now, as far as patient concerned, who cared about the patient in the first place? That's my question. Did anyone care about the patient? No. Answer is no. So it's all the, patient is still there. I mean, I think we need to have program for the patients also, mindset change program. Hey, expect something quicker, decrease your expectations from this process. I see a major change in the insurance companies actually, and if the AI companies can work, AI programs can work, so that the insurance companies pay on time or insurance model itself is replaced. Let people pay cash, and people who cannot afford, the government steps in. So the mix of universal health care and mix of this, which nobody wants in this country right now, but eventually they'll be forced to do that. But AI is going to force them, because the companies want money. They want money today. So they want, whosoever pays, they don't care. The government pays, patient pays, anyone else pays. So I think a lot of changes I'm looking at, and the private healthcare. I'm sure a model will come in where they will say, if you want private healthcare, this is a different premium. If you want government healthcare, this is a different premium. I think that's going to happen. AI is going to force it.
Okay.
And with the transition, so the market is changing, and do you see that the academic community, be it medical schools, nursing schools, have already built this into their curriculum, or is it still to come?
Actually, they should not even focus on this. The medical fraternity, or the our schools, only should focus on preventative medicines, like, so that we can stop cancer at the source, change the food eating habits, stop processed foods industry. They have to focus on those kind of things, and they should not be involved in billing and how the AI is influencing. Because I don't want to go to a robot to cure me. I don't want it. I don't know which vein is going to put the needle in, and even though it's a very regulated and tested 1,000 times, but I need a human being to cure a human being. So that should not change, I think. But AI is going to change many of the operation functions, ICU functions, also the medicinal procedures functions, where even a doctor is not needed for certain things,
Correct.
Yeah.
like blood testing.
Right. So this brings me to my last question to you from the healthcare worker, doctor, nurse point of view. How likely do you think some of them might actually sabotage the AI, the programs, so that they can keep their job, making the AI look bad, that it wasn't they who made the error, but the AI.
That is very real, because it did happen when the computers started coming over. And the most famous alibi was my computer crashed.
Yeah.
My computer crashed. You have heard so many times, oh, computers have crashed, we can't function. Now everything is cloud based. So only thing you need is internet connection. And I think the security is a big thing on the mind of people in the HIPAA regulated environment. In a non-HIPAA regulated environment, nobody cares. But in a HIPAA regulated environment, is security is a big thing, can be hacked, cannot be hacked, or how the security of those transactions happen. And I see in this entire example, the security professionals will actually have a upside. The IT security guys will have more jobs created over there. So we're reducing jobs on the patient side. So the patients will have to face a wall or a computer or a tablet. But the IT security guys will have a boom time
Yes.
for next 10 years. and even that will be replaced by AI. So I think we human beings are looking at going back to farming. That's what I see, and living a life off the land, which I very much prefer actually, than to have this kind of lifestyle. But most of the diseases are based on we have no physical activity, less physical activity, more conveniences, and that's where the disease is coming from. The thing where I foresee a change from our side is that how we function, how the new mindset is needed in healthcare industry, new training for the staff, that most of the staff will be running AI bots and testing the AI bots before the clinic opens in the morning. So all those things will require a severe change in the internal functioning of small clinics, big clinics, and even hospitals. I see more changes coming on the emergency rooms actually, because emergency rooms take up the maximum number of patients, emergency patients. I think that's it for today.
Yeah, that we covered all the points, and it's happening quick. It's been happening, but again, people think it happens overnight. So things are going to be seen overnight. You're going to show up at the emergency room, and it's going to be a whole new place.
And I think people should take join us on this website to see how we can use the systems or programs that we develop for keeping up with the AI. That is very much needed. I think we are pioneers in this. This particular thing is pioneer. LearnThinkShare.com. So do sign up and let us and join our training so that you can see how you can overcome these challenges.
Excellent. Absolutely. With every challenge becomes opportunity. So take advantage.
Thank you.